Beginner's tips for choosing the right size menstrual cup. A menstrual cup is a small funnel shaped flexible cup typically made of high quality medical grade silicone or latex rubber that you wear inside the vagina to collect the menstrual blood during your period. Normally, you can wear the menstrual cup for 8 to 12 hours without worrying about leakage. If you experience normal blood flow, you can even wear the menstrual cup overnight. Before using a cup for the first time, it's important to read the directions on the packaging carefully and wash or sterilize it accordingly. It's important to note that not all cups are reusable, so be sure to read the label if you prefer a reusable cup. Some brands are disposable, you can throw them away after each use. With proper use, menstrual cups are safe to use. Sometimes, due to various reasons, you may find that your cup is leaking. A few reasons for this can be picking the wrong cup size, not inserting it properly, using a cup that was too small, abnormally heavy bleeding, not emptying it in time, or not having it pop open inside. How to choose the right size menstrual cup? One of the challenges of finding the right menstrual cup for you is that not all vaginas are shaped the same way. You may have a small vagina and a heavy flow. It's more important to find a cup that fits you properly than to try to find a cup that you can wear for the maximum amount of time or that holds the most blood, because cup size should be determined only by fit, not flow. To find out the right menstrual cup size, you need to consider the following factors: your age, the length of your cervix, whether your menstrual flow is heavy or low, the capacity of the menstrual cup, the flexibility and firmness of the menstrual cup, and your pelvic floor muscle strength. Menstrual cup is usually available in three different sizes: small, medium, and large. Some cups come in two main sizes, large and small. The larger one is recommended for people who are over 30 or have given birth vaginally, and the smaller one is recommended for people who are under 30 or haven't given birth. You will have to choose or find a size according to your needs. The length of your cervix. When it comes to menstrual cups, the height or length of your cervix will determine the length of your vaginal canal. Hence, the first variable you will want to figure out about your vagina is how long it is. This in turn will indicate the cup size you require that will be suitable to collect your menstrual blood without leaking or being uncomfortable. How to check the height of your cervix? Simply insert a finger into your vagina. If your cervix is hard to reach and you can't feel it at the end of your finger, your cervix sits high. If you can touch your cervix by inserting some of your finger, you have got an average vaginal length. And if it takes only a tiny bit of your finger to reach your cervix, you have got a low cervix. Remember, your cervix height will vary throughout your period, hence it's best to do this test when you are actually menstruating. A consultation with your gynecologist can be helpful before you decide to switch to a menstrual cup. Take into consideration how heavy your blood flow is and the cup capacity. Capacity of the cup is probably not as important as getting the correct length cup. However, it's still something to consider. If you have a heavy flow and you get a small cup, you may need to empty it more often than if you get a cup with a larger capacity. Finding the right capacity cup can be tricky if you haven't used a cup before. Once you use a cup, you will know exactly how much your flow is because you will be able to see it in the cup, and some cups even have measurement lines. Normally, a healthy female loses blood up to 50 ml in total over her whole period. Anything under 25 ml would be considered quite light flow, and anything over 80 ml would be considered heavy blood flow. Based on your flow, just consider buying a light flow capacity cup, medium or large. The other main distinction between different cups is firmness. The firmness of the menstrual cup can vary between brands. Some cups are softer than others, some are harder. The firmness can make a difference in how comfortable you find the cup and how well it pops open inside to create a leak-proof seal. Your pelvic floor muscle strength. You may find a soft cup more comfortable if you have any bladder issues, pelvic pain, or weak vaginal muscles. Normally, a soft cup won't apply much pressure internally, but it may be more difficult to get open once it's inside you. If the cup doesn't open properly, this will cause leaks. If you don't have any specific issues, then you should be okay to try an average to firm cup. Firm cups are generally better for younger and physically active users. Some other less important choices you will wind up making about your menstrual cup are things like color and shape of the stem. Depending on the brand, cups come in different colors. They have frosted or slick finishes, grip rings or no grip rings. Stems can be regular, ball shaped, hollow, flat, or cylindrical, and these things don't matter all that much. A light colored cup will be stained more easily, and cups that have a lot of ridges, holes, or raised text on them can be tiny bit harder to clean. But darker cups make it hard to see any residue that still needed cleaning. Using a menstrual cup can be tricky at first, but it can offer a lot of benefits in the long term. If you aren't sure if a cup is right for you or don't know how to choose a cup, ask your doctor for more guidance. If you like this video, please give this video a like, share it with your friends and click the subscribe button to enjoy more such videos. Thanks a lot for watching this video. Bye bye.